this video I will list 10 ways in which modern medicine is still treating women like a minority, even though we make up 50% of the population. You're having chest pain, tightness of breath, classic signs of a heart attack, right? Except for women it might not be chest pain at all. It could be jaw discomfort, back pressure, or nausea. And because medicine has long used the male body as its standard, about 50% of women suffering a heart attack are misdiagnosed or underdiagnosed. And I am bringing this up today because after reading this book, I realized how little I knew about this problem, and that it can be of interest to you too. Maybe you are a fellow woman, or a scientist or a doctor who, like me, was not aware of the extent of this problem. And finally, maybe you are just a random dude who just wants to understand the world a bit better. So, let's go! Hi there! I'm a vet, a neuroscientist, and an author of several neuroscience studies. On this channel I explore how the brain works and decode its mysteries, but importantly I like to explore how these facts affect our lives. So, if this sounds like something right up your alley, well, you know what to do. I think we have all heard of the thalidomide tragedy, where an over-the-counter drug was being given to pregnant women against morning sickness. This drug was later found to cause birth defects when taken during pregnancy. So what happened was that the regulators panicked, and instead of studying women safely, they decided not to study them altogether. And this is because in 1977 the US Food and Drug Administration made a sweeping decision to exclude all women of childbearing potential from early phase clinical trials. And this was taken in order to avoid another tragedy. And on the surface this sounds very protective, right? But it was so broad, it basically meant no premenopausal women could participate in drug testing. So, for the next 16 years, almost every major drug was tested primarily on men, then prescribed to everyone. This was made under the assumption that the human body is practically the same, except for our reproductive organs. Apparently, we reached equality in the wrong way. When that policy was finally reversed in 1993, it meant we'd already spent decades building medical knowledge on only half of the population. So, fast forward to today. You would think that we have fixed it by now, right? But women still make up the minority of clinical trial participants, and much less in early phase trials. It means that women are underrepresented when it comes to reporting adverse effects. Even worse, when you factor in race and ethnicity, women of color are the most underrepresented of all, unfortunately. And I'm sorry for saying this, as it might sound like common sense, but if you don't study women, you can't know how diseases or drugs behave in their bodies. And just to point out major differences, in general, female bodies are smaller, have different bone densities, and different body compositions. For example, men have more muscle and women have more fat by default. And this is not to account for how female bodies change throughout every month according to hormonal changes. Before drugs reach clinical trials, there is preclinical research. And this is where my profession comes in. Unfortunately, us researchers have also failed women. As scientists, we often use male animals for experiments. And even when we use cells, the donor is usually male. So there are reasons for this, and it is basically convenience. Because it is a general belief that using females gives too much of a variable result. And actually, we hate variability because it screws with our statistics. So now there is even growing evidence of studies which are showing that you do not need a whole organism to show sex differences. But in general, even a single cell has a different response depending if the donor was male or female. For example, the immune system reacts differently, even in the brain. And this research gave insight into why women are more likely to develop autoimmune diseases. Nowadays, more and more funding agencies want to see results segregated by sex, and one starts to see more articles highlighting any differences observed. And so slowly, gently, it is being corrected. But yeah, not to point fingers at anyone, but basically I have also ignored my own sex in my own work. Heart disease is the #1 killer for women, yet for decades medicine treated it like a man's disease. The textbook heart attack symptoms, crushing chest pain, left arm numbness, were all discovered in men, but women's hearts often tell a different story, and that is shortness of breath, nausea, jaw and back pain, and extreme fatigue. And As you can see, these really do not fit the male template, right? So when women show up at the ER or at the emergency room, they're misdiagnosed and sent home twice as often as men. Some studies show that women are 50% more likely to be misdiagnosed after a heart attack. Even the drugs used for heart disease, like beta blockers, were tested predominantly in male patients. Their effects in women are often assumed, unfortunately not measured. Well, and the result of all of this? As you might have imagined, it is rather deadly. Women die from heart disease at higher rates than men, even though they're just as likely to develop it. Did you know that women are 73% more likely in getting seriously injured in a front-end car accident than men? Well, this is because the crash test dummy is built on male physiology. So how seatbelts are placed in the car are there to protect male physiology, and unfortunately not the female one. And similarly, almost every drug on the market was developed using a 70-kilogram male body as the standard model. But bodies differ in nearly every pharmacological way, because we have more body fat, less water, slower gastric emptying, and different liver enzyme activity. These differences mean that the same pill can hit differently. So the outcome is that women are twice as likely to suffer adverse drug reactions compared to men. For example, let's take a famous case, like Ambien. When the sleeping pill hit the market in the 90s, it was prescribed equally to men and women, same 10 milligram dose. But 20 years later, after thousands of car accidents and morning grogginess reports, researchers found that women metabolize the drug more slowly. So in 2013, the FDA cut the recommended dose for women in half. And here, Ambien wasn't an exception. It was just the first time regulators publicly admitted that dosing needed to be sex-specific. And this is not to mention drugs which were found to not be effective in women at all. But anyway, you've probably heard of women being told their pain is all in their head. Unfortunately, that's not a cliche at all. For example, in this book that I mentioned earlier, the author brings a couple of individual stories where women were ignored for a decade until their symptoms were taken seriously. And to prove this, studies show that women wait longer for pain medication in emergency rooms, even when describing the same symptoms as men. And part of this bias stems from early pain research, which focused on acute male typical pain, like injuries or burns. Chronic pain, which affects women disproportionately, like fibromyalgia and endometriosis, were labeled as psychosomatic. And because researchers often exclude women in their studies, we know less about how female bodies experience and process pain. So, when women report ongoing pain, doctors sometimes assume exaggeration instead of inflammation, and the result is a delayed diagnosis and, unfortunately, unnecessary suffering. Okay, so before we continue, why am I sharing this? When I had the idea for this video, I was conflicted of whether to make it or not. On one hand, I wanted to share the story, because I think it is very important for every person to know this. But on the other hand, I did not want to bring this message in a way that points to a group of people and saying the classic and general men are bad. Unfortunately, I find that nowadays there are a few people who use being a feminist as a badge of honor to show off, rather than to bring awareness and change. And personally, I think this attitude is more harmful than beneficial for the cause, because it makes people defensive and closed, rather than open to the new idea and change. Inequality between male and female does indeed exist. And often it is staring right at us without us even noticing it. Like for example, all the points raised in this video. And here I have to point out that even though healthcare is my business, I was not aware of some of the points in this video. It was really my blind spot. So yeah, I do have a huge admiration for the work of women all over the world who try to bring awareness and change. Like for example, the author of this book. So I hope that this video is making you more aware of how our world is measured and designed. And I am curious if any of the points raised here, well, that you can take with you in your everyday life. Let me know in the comments down below if this is the case. And yeah, with this, let's continue with the video. We now know that women's immune systems react differently, which helps fight infections but raises the risk of self-attack. Estrogen amplifies immune responses, while testosterone tends to suppress them. Autoimmune diseases like lupus, Sjögren's, and rheumatoid arthritis disproportionately affect women. In fact, about 80% of autoimmune patients are female, and yet most animal and human studies historically used male models. Pregnancy, birth control, and also menopause are major hormonal shifts, which can dramatically change how autoimmune conditions behave. But few trials ever studied this properly. So even in 2025, treatment guidelines rarely address how to tailor immune therapies to the menstrual cycle or menopause transition. And well, this again is very inconvenient, because to run clinical trials around hormonal cycles is crazy complicated. Well, there are way too many variables to take into account, and this will add millions, if not billions, of additional costs. And we don't want that, right? Neurologically, women are more likely to develop migraines and Alzheimer's disease, while men are more prone to Parkinson's. Even the most common form of dementia, which is Alzheimer's disease, affects women 2/3 of the time. Yet, for years, scientists dismissed it as women living longer. Only recently have studies explored biological causes like estrogen's role in amyloid accumulation, for example. But for decades, these conditions were studied mostly in one sex. And as mentioned earlier, this is not only at the clinical trial level, but also at the in vitro or animal studies level. Well, and this trend does not only apply to treatments, but also the diagnostic tests themselves can be biased. Autism, ADHD, both were defined using male behavioral patterns. For example, girls with autism often mask social difficulties or present with quieter traits, so they're underdiagnosed. In fact, for a long time, the general medical consensus was that autism is predominantly a male disease. However, it turned out that the DSM, which is the book that offers diagnostic guidelines to psychologists and psychiatrists, is actually describing male symptoms of autism. And in fact, while by the age of 11, 50% of the boys with autism are diagnosed, unfortunately only 11% of girls are diagnosed by this age. And here it is good to highlight that this happens because if we use men as the standard to study and understand disease, we are also blind to any deviations from the standard chosen. And mind you, this point is not only valid for women, but also for men for other races. Because racial differences are not just in appearance, but sometimes it can also result in differences in how drugs are metabolized. For example, East Asians have a high frequency of poor metabolizers of certain liver enzymes, which would probably need a lower dose or frequency, while, for example, Africans were more likely to express a particular liver enzyme, which would increase the clearance of certain drugs, and therefore they would probably need a higher dose of the drug to match the standard human. And as you can imagine, if men are the ones who are studied, then the knowledge obtained from men is the one used to teach. Most doctors today went through medical school when sex-based medicine was barely a topic. Even in 2010, fewer than 30% of medical schools integrated sex differences across core subjects like cardiology or pharmacology. Instead, they were taught one anatomy, one physiology, one average patient, which is the male. For women, there was only obstetrics and gynecology. So practically, women's health was treated as a specialty, and this is because the underlying assumption is that we did not question for decades was that women are like men except for their reproductive organs. It is sad really that we live in such an advanced society and still overlook these things. However, it is not all doom and gloom. In 2016, the NIH officially required researchers to consider sex as biological variable, even in animal studies. In fact, funding agencies now demand sex-balanced study design, which is great. Also, medical schools are starting to weave gender-based medicine in their curricula. And we're seeing early steps towards precision dosing, where treatment is based on race, sex, weight, and even genetics. But as always, change is slow because there are centuries of misconceptions and knowledge gaps that need to be revised. I know it sucks, but with anything in life, the first step is at least awareness. And this means that our job is to make sure to analyze our environment and see if we can change anything in the way we do things. And if not, just remember that awareness drives change. And the more we talk about it, the harder it is to ignore actually. And if you are still here, you might also like this video over here, where I talk about the drastic anatomical changes that the female brain experiences during pregnancy and after birth. And with this, thanks for watching and see you in the next time. Ciao!